reason why we've organized this week that includes an exchange match is we felt that it would benefit for leaders if they could be connected with their colleagues overseas, and then they could build their own collaborative partnerships. So not only would they learn while they're here, but they could continue to learn after they left here.
It's very inspiring to be together with like-minded people who are doing really positive programs and actually seeing results.
For this exchange, we can learn and brainstorming. Especially, you can find a group of people they have vision, and you can learn from those of them, and you can build up your own vision for your own country.
Essentially, learning what you're doing, exchanging ideas about what's being done. Quite often, that's the basis for adapting to local circumstance and needs. That stimulates you to think of new ways to address some of the problems that we're all grappling with.
There are several things we really want to have happen out of the exchanges. One is for people to be linked with their colleagues overseas. Second, be able to transfer knowledge quickly between one country and another. And third, be able to benefit their organizations by they helping connect with their colleagues to be able to answer questions and be able to share knowledge so that we rapidly get creative ideas from one country to another.
I think that we all tend to look at things from our own worldview, and so engaging the minds and experiences of other people from different parts of the world allows us to expand the way we look at things and potentially find solutions to problems that we wouldn't ordinarily think about.
The numbers range, but there are some numbers around 10% of that are folks who struggle with some sort of mental illness.
It's a valuable process in terms of exchanging ideas, understanding what people do in other countries to serve seriously mentally ill people, and being able to share some of our own ideas and get critical feedback from the visitors that are here.
As an agency, we have worked very hard over the last probably 25 years since Dr. Campanelli founded the agency on really bringing the cutting-edge technology to the services and the treatment that we provide to our residents and to the folks that we treat in our outpatient mental health clinics, our support programs. And so we learned so much from our colleagues that we thought that it would be great to see what we can learn from our colleagues around the world.
I selected this particular host component of the program because I'm interested in step-down programs in relation to clients who've been in a mental health facility. They've then gone into supervised living in the community to their actual living independently, and what kind of programs are out there around the world and what's their success rate. So that's my goal, is to find out more about that.
There is a growing list of evidence-based treatments for seriously mentally ill people that are equally applicable in other countries and certainly in other states. And it's interesting to talk a little bit about how those evidence-based practices differ from place to place in terms of their implementation.
I'm keen to catch up with people I made contact with before. I'm really keen to hear about innovation from around the world to take back to my home country of New Zealand.
We are based in New York City, which is, I guess, in a lot of ways the capital of the world in terms of where our corporate headquarters are located, a couple blocks away from Wall Street, a couple blocks away from the World Trade Center. Yesterday we celebrated the 10th anniversary of the horrific attack on the United States. And so in terms of that, I think that we bring a unique perspective, of course, about trauma and trauma-informed work. We also, because we're in New York City, we're a melting pot, and we have, I think, a unique perspective on culture and cultural diversity.
It's the first time to New York, so it's certainly been an experience, being here for the last 2 days. It certainly is a city that never sleeps.
My goal was to try to develop enthusiasm and get the momentum going to address this particular issue, because it's something that's near and dear to my heart, and an area that I think that there's a definite need for in the U.S. and throughout the world. And so my goal was to try to create a successful event that people would want to continue on with the collaboration and to produce something meaningful for everybody to use related to helping military families.
Right. Because the 60% of the primary care appointments to primary care provider, 60% of them are related to mental health issues. That's a very high number.
It's just the sorts of things that come up in an exchange like this. For example, drawing my attention to how far the Defence Centres of Excellence have gone in terms of new media and new technologies. You know, that can be something that prevents us from reinventing the wheel. Likewise, I think exchange where you can start to decide on some common measures so you can do comparative work that's, you know, powerfully cross-nationally comparative, I think is a very important thing. I think also sharing practice across borders. You know, none of us has a sort of mandate on creativity and innovation. And essentially, you know, learning what you're doing, exchanging ideas about what's being done, quite often, you know, that's the basis for adapting to local circumstance and needs. That stimulates you to think of new ways to address some of the problems that we're all grappling with.
Having the international participation is really exciting because we're discussing cultural differences that we ordinarily wouldn't be looking at. I'm always interested in different people throughout the world, the differences between the ways that people look at things, and especially the issue of mental health. There are a lot of differences throughout the world in terms of how people are educated, how the general public looks at it, how the military addresses mental health issues, and so it's just been really fascinating to engage at this level.
What's really unique about what we've been able to do with our exchange is to have a group of clinical leaders, people who are responsible for the clinical care of people across a country or across a region, that are really leaders in the field, to come together and talk about the best ways to assess the quality of mental health care.
Every country have their own problem, but we sit together to try to figure out the good quality indicator as more initiative for each country to improve themselves. So this is quite a great idea to share and exchange among different countries.
We learn about their different approaches that they've developed from their own country, how they've adapted some of these approaches to their own clinical needs, to their own population needs, to their own cultural needs, to also with regard to the kind of different mental health systems that they have in their countries, which provides unique insights about how we might apply it in our own country that we hadn't thought of, because we just simply haven't had the exposure to these different approaches.
Coming in, I kind of anticipated that there would be a high degree of disparity between countries about capacity to measure indicators and outcomes, but I think at the end of the day, it seemed easier to come to consensus than I would have anticipated.
One of the things that really struck me today is how we're all very clear about what the sort of scientific approach is and what's evidence-based and that rigour that we can bring. We're well accustomed to that, but setting that aside, it struck me how unified people were in terms of the ethical dimension and the direction of travel that we're all agreed to. Absolutely everyone is signed up to trying to improve mental health services, not just the services but also the experience of people who use mental health services, and ultimately driving up better outcomes. So that's been a real eye-opener for me, but also tremendously reassuring.
Each time I attend the meeting, the conference, give me new inspiration to how the system to get more involved, to change the relationship between physician, doctor, and our consumer, our client, and family. So those ideas more and more put into the healthcare system, especially mental healthcare system in Taiwan.
We're really going to have a product from our work here in the Clinical Leaders Group. We've already developed a large number of scientific papers that have been published in different journals around the world. And the intent is that the result of the work we're doing today, which is actually to have a kind of consensus using a Delphi process on what might be a set of quality measures and a framework for assessing quality that could be applied across countries will be produced in a series of scientific papers that we hope to develop over the next year or so.
There's been tremendous value in this exchange. I've always been enthusiastic about the role of outcome indicators, and I'm a convert, have been for a long time, but I think I'll be returning to Scotland with an increased passion for the area and I suppose greater confidence about encouraging my fellow clinicians, fellow managers, fellow planners to actually aim for very high levels of standards of care. So I think this will really invigorate that kind of, I suppose, essential leadership element of driving improvement in services.
The goal is around the leadership needed for changing systems within the wider context of mental health.
It's the opportunity to share information, to find out what is happening elsewhere in the world, and that ability to be able to network with like-minded people that are doing similar things, even though we are from many, many different countries.
It's a bit like asking me what my favourite food is. Do I have to only say one? So given that, I'm going to say two. The wellness program for staff, where the recovery principles and the strength-based approach that's used for our client group also applies to all of the staff at all levels. I think that was really inspiring, and I got a lot out of that and a lot of tips. And the other thing that was absolutely sensational was the amount of effort that's gone into developing up recovery assessment tools and measurement tools, particularly the ones where the clients get to measure where they're at, as well as the clinician. I thought, that really is a way forward, because most of our measurement tools are deficit focused and they're done by staff to our client group.
I brought a wonderful Australian accent, a sense of humour, as well as 30 years of working in mental health and providing some different perspectives and being able to generate some discussion and having some differing views about things, I think provides good opportunities to talk with people and work through things to get a better understanding of why we're doing what we're doing.
One of the really inspiring things today is about the culture within the Denver Mental Health Centre, and linked to that is the passion and drive of the people working within here is very, very high.
Well, it's been exciting and amazing that to learn that even though New Zealand has a very different healthcare system, they have a universal coverage, that we face a lot of the similar challenges and problems in the United States in a very different kind of system.
Essentially what brought me to the exchange was the opportunity to understand and learn a whole lot more about how we can make the most of opportunities that present to us within New Zealand, within the organisation I work for, Pathways, where we have a really rapidly changing landscape, and we have a kind of an intent to deliver more efficient and better services, and we have the challenge of having to deliver twice as many services in the next 10 years with only about a 30% increase in funding. So within that is the need to understand how we create greater efficiencies in delivering mental health and addiction services, and part of those efficiencies is around engaging in a stronger way with primary health organisations and positioning ourselves as a partner to primary health organisations to deliver mental health and addiction supports. So when I had the opportunity to look at the different site visits, and I saw the Jefferson Centre for Mental Health and what they had been doing around integration between their behavioural health programs and their primary care programs, it was a really easy decision to make contact with them and to come along to Denver here and get a good sense of what some of the challenges they faced and what some of the kind of critical things were that made that integration successful. And essentially that's why I'm here, and I've we're only one day into it, and I'm already feeling really kind of overwhelmed with information about the possibilities and the potential. So
they're doing some fascinating things in outreach and branding and marketing and building community support and establishing their identity with their clients and consumers and payers. And we're doing some different things, and so we have some very interesting discussions that weren't part of the planned agenda. They just happen as a sort of serendipitous outcome.
One of the things I think we're all exposed to is an expectation from people who use our services that our services will be responsive to them, that they'll be, that they'll be involved in determining what's going to happen for them and how that's going to be of benefit, and I think that's a universal thing.
I think some of the similarities are the historical legacy of colonisation that's affected Indigenous peoples and families in particular, and the intergenerational effects that go down to our youth today. So it's not like history is something of the past. It's very present in the mental health issues that we have today. And the approach is very similar in that the importance of identity, of culture, of representation, they're all there. The importance of traditional healing, for example. These are different pathways that Indigenous people have that we're still struggling to get accepted into the mainstream agenda. But it's happening. The struggles that we have internationally for Indigenous peoples and in regard to mental health are really the same. And I think what I've probably learnt the most is that the importance of culture within services is absolutely essential if we're going to get recovery.
The feelings are the same, maybe the individual customs of the Indigenous cultures are different, but the things that have happened to them and the things that they have gone through are, as presented today, yes, they definitely are.
I guess the next steps are always about pushing on. The thing I love most about coming to an Indigenous exchange is the sense of community, the sense of connectedness, of family, and knowing that you have an international community that's supporting you. So it rejuvenates you to go back and try that little bit harder, to get mental health on the agenda, to get Indigenous mental health on the agenda, and to make sure that we're getting the best outcomes both from mainstream as well as Indigenous services, that it's actually going to improve the sort of well-being of the next generation. So dealing with the here and now, but also putting into place those things that are going to improve the outcomes for our children.
It was an excellent conference, excellent presenters, excellent information. Yeah, a lot of it just blew my mind.
Well, this is my fourth exchange. I had the honor of co-hosting one of the exchanges, I guess, back in Ottawa several years ago. And it's developed a real friendship with a number of the other leaders, and we look forward to being able to get together to find out what each other's doing, looking at some new and innovative ways of solving some old problems, but also thinking outside the box together. So it's a real opportunity to really stretch how we think about child and youth mental health.
There's something about being with people who share that passion about under 18s, of not having to ask what about under 18s, what about children, but to be with people whose interest and career and concentration is on that population. It's been fantastic to learn about good practices that are happening in other nations, things that we can use and bring back to Scotland, but also things that we can share with the group about things that we're doing in Scotland that might be useful for other contexts.
And to see, are there actions, strategies that we can all take together?
There's obviously value in the information that's being shared, but there's an experiential part of this. I mean, you're really developing relationships with people that are in similar kinds of situations as your own in terms of leaders in different constituencies around the world. And to be able to talk really frankly about how do you actually do your work, how do you conceptualize the problems, and looking with conversing with peers and being able to dream a little bit about the solutions is quite exceptional. It's a unique experience.
We've had discussion around evidence-based practice about using outcome measures and thinking how we might implement those well within the service that I work within. I went on a site visit yesterday and heard about support, peer-to-peer support for informal carers of children kinship care. And I think that's something that, again, in the area where I work, that we can do more for. I think we're quite good at doing some sorts of support, but not so much for the informal carers.
Biggest value for me is the networking, the chatting to other people, seeing the different services, actually going out there and seeing how it works, and being able to chat to people very informally about their experiences and their difficulties, the obstacles they come up against, how they've gotten over them, you know, and just that sharing and learning with each other.
What we found is that these networks have really continued to prosper, because what happens during those first 2 days, not only do they meet each other, but they become friends, and they become colleagues. So what we've seen is several of the exchanges matches continue to prosper, exchange staff, do research together, contact each other, and it really gives them another avenue to get support.